Harriet Hall says that several people asked her to review the movie What the Health. She watched it and she took notes. I decided to take notes of her review, and I decided to share them with you. Hippocrates existed a long time ago, therefore, what he has to say can't possibly be relevant to us. Also, quoting him is a logical fallacy. Let's see. Quote, "My skepdocs rule. Before you accept a claim, try to find out who disagrees with it and why." Unquote. So this is me quoting a seemingly wise piece of advice. From whom? Well, from Harriet Hall. Of course, she's a doctor and a skeptic. So did I just commit an appeal to authority fallacy? No, Harriet. An appeal to authority takes the form of first establishing that someone is an authority, and secondly, that whatever they say on the topic that they're an authority on is probably true, as in, you're encouraging others not to examine the claim for themselves. Here's an example. 1. Harriet Hall didn't like What the Health and says it's vegan propaganda. 2. Harriet is a doctor and skeptic. She runs a well-known blog, which is not funded by industry. 3. Therefore, you can trust that What the Health is vegan propaganda, without looking into it yourself. See, that takes the form of an argument. It's not simply a quote. This is an appeal to authority. And this is, funnily enough, what this article that you wrote serves to accomplish for many people. Many people who will link this article on Reddit or Facebook or elsewhere do so only after they've read the conclusion, which appears at the very top of your review, and claims that this is vegan propaganda. Why would they do this? Well, of course, because they have their own confirmation bias to protect, the very thing that you claim to be fighting against here. Did I hear someone say appeal to personal incredulity? Yes. Wait, isn't Doc Harriet aware that this is a logical fallacy? This is true. What Harriet fails to mention is that no one escapes confirmation bias, and she has a pretty clear anti-vegan bias to defend herself. Yes, Harriet, you're right. To hell with all observational data. We, the real scientists and skeptics, only want double-blind, randomized, placebo-controlled crossover trials to establish cause and effect. Anything else is just shoddy science. What Harriet is saying here is that we have no evidence that parachute use prevents death and trauma related to jumping off of planes. That's right. Where is the evidence that parachutes help prevent death? Where are the trials? Well then, we have no reason to recommend people use parachutes before jumping off of planes. Ah, the wisdom of skeptics. First, Harriet mentions one serving but fails to mention what that serving is and how people typically eat. The serving mentioned is a serving of 50 grams. Everyone that I know who buys and enjoys processed meat, even when they think they are doing so in moderation, actually eat more than 50 grams of it per day, and usually so per serving. Do you know many people who eat only 2 slices of bacon with their breakfast, or who only eat one sausage? They only make one hot dog for lunch? These are high-fat, high-salt foods, usually also containing some sugar, and they're addictive in nature. A couple slices of bacon are unlikely to hit the spot. But this is downplayed here. It's not even mentioned what the serving size is. Wow, this is a very misleading paragraph and just shows more of Harriet's bias influencing her judgment. Confounding factors are by definition outside factors. Saying that it might be the high salt content of processed meat that's responsible, whether in part or entirely, for the increase in cancer risk is like saying that arsenic in cigarettes is a confounding factor when you smoke. The meat becomes processed meat because it's been cured, i.e., salted. It's intrinsic to the product and it's termed processed meat, so it's not a confounding factor. Harriet's deceptive suspicion of salt being a major culprit here is likely to make one who trusts her judgment simply look for low-sodium options when it comes to meat products instead. What she omitted to say is that the WHO answered this question. Number 18 of their FAQ says, what makes red meat and processed meat increase the risk of cancer? And they respond by saying, meat consists of multiple components such as heme iron. Meat can also contain chemicals that form during meat processing or cooking. For instance, carcinogenic chemicals that form during meat processing include N-nitroso compounds and polycyclic aromatic hydrocarbons. Cooking of red meat or processed meat also produces heterocyclic aromatic amines as well as other chemicals including polycyclic aromatic hydrocarbons, which are also found in other foods and in air pollution. Some of these chemicals are known or suspected carcinogens, but despite this knowledge, it is not fully yet understood how cancer risk is increased by red meat or processed meat. So in short, she is once again selling her audience short. Secondly, the study in question did establish cause and effect. They found mechanistic data to support the link between processed meat and cancer, and that's why it's in the Class 1 category. This is the most robust form of evidence that we have, which means that confounding factors were not an issue. Why is she even mentioning them? Lastly, go look at the UICC's website, which she gets her information from. They are sponsored by so many orgs who actually benefit from people being sick. Of course they will be fine downplaying this. The American Cancer Society is there as one of their patrons program. They're sponsored by the meat industry, of course. I lost count at how many pharmaceutical industries are partnered with them. Oh wait, am I being paranoid? A tinfoil hat wearing conspiracy theorist? Harriet then claims that the documentary says that eating processed meat is just as bad as smoking cigarettes. No, they simply said it was put in the same category. But Harriet suggests that the documentary deliberately makes it vague for people to do so. But you can be sure that most reasonable people will know that if it was just as dangerous as tobacco smoking is, they wouldn't be first hearing it from this documentary. All of us who have studied nutrition know that the national health recommendations are imperfect, and industry influence plays a big part in those recommendations. The WHO must still support them, but that doesn't mean we have to blindly accept this. Who is the skeptic here again? How much meat in one's diet has, quotes, known health benefits? There are no sources to those claims. We have no reason to believe that the exclusion of meat from one's diet will make one's health likely to be worse than with the inclusion of some meat. And it seems wholly arbitrary. Where is the, quotes, tolerable daily intake data? Oh wait, they actually answered this right underneath where Harriet cherry-picked. How much meat is it safe to eat? The risk increases with the amount of meat consumed, but the data available did not permit a conclusion about whether a safe level exists. So everything in moderation is more reasonable than better safe than sorry? This is patently false. It's amazing how easily people accept the sugar industry's manipulation of data due to how much money and power they have. but aren't willing to extend that to big meat, dairy, and egg. It has taken an enormous amount of effort by groups like PCRM to get the nutritional guidelines to change towards a more favorable one, based on science, notably with My Plate. PCRM actually sued the USDA over their deceptive guidelines, and they won. Nutritional guidelines have always been a compromise between what consumers want and what's good for industries. Here in Canada, we have only just started discussing the new suggestions that plant sources of protein should be favored. And the new draft food guide eliminates dairy as a food group. We know how confusing the guidelines have been for the average person and how lobbyists were allowed to create this fog around nutrition with things like reduce saturated fat and replace with unsaturated fat. Some of us know that what this actually means is to reduce meat consumption and dairy, or at least full-fat dairy, consumption as well. But for the average person, they would obviously benefit from hearing to reduce the actual food that they eat and not the constituents of the food that they have not studied. The guidelines have long been vague and confusing for the average person, but things are progressing. But wait, I thought epidemiological studies could only ever prove correlation and not causation. What about all those confounding factors she referred to earlier? Why does this paper, which has only been cited once, interest Harriet Hall so much? I don't know. Why did she not review the paper with the 70% figure from the documentary instead? It comes straight from the CDC, which she quotes right after this. I couldn't access the paper that she's referring to because it's behind the paywall, so I can't comment on it. Well, I can say this. Once again, she appears to be downplaying the significance of adopting a plant-based diet, which abandons red meat and processed meats entirely. She gives us these small figures separately, as if they mattered in a separate way, as if eating didn't involve an opportunity cost. When you change your diet, a sustainable diet, a way of eating, you're not only cutting out red meat and processed meat by doing so, you're necessarily increasing your intake of other foods to replace those. And they are most likely going to be fruits, vegetables, legumes, whole grains, nuts, and seeds, in the context of plant-based eating. Anyway, the study that she linked concludes that dietary factors were estimated to be associated with a substantial proportion of deaths from heart disease, stroke, and type 2 diabetes. So now we're just left arguing just how substantial that portion is. Digging into this, I found that there seems to have been contradictory figures given out by the CDC. I tried finding the 70% figure on their website, but I couldn't find it. But it wasn't made out of thin air by the documentary makers. I found a paper which quotes the CDC saying that chronic diseases, such as heart disease, cancer, diabetes, are the leading causes of death and disability in the United States. Chronic diseases account for 70% of all deaths in the US, which is 1.7 million each year. Chronic diseases such as heart disease, stroke, cancer, diabetes, and arthritis are among the most common, costly, and preventable of all health problems in the US. It appears that the CDC changed this information, but I couldn't verify it with the Wayback Machine, which is an archive of snapshots of web pages at different times. Either way, we have to go with what they're currently saying. Or do we? We could look at, for instance, the Global Burden of Disease study, a more recent study and the largest, most rigorous analysis of risk factors ever published. It was funded by the Bill and Melinda Gates Foundation, and it found that dietary risks trump tobacco smoke for death and disability in the US. This is the data for 2015, and this is the data for 2010, along with more in-depth detail about which foods should be emphasized. So that 70% figure doesn't seem too far off to me. Diet has a relatively small impact when compared to other lifestyle factors, says Mrs. Hall. Really? She links this 2017 systematic review as if it was the most up-to-date information, but when you actually click on it, you can see that it's from 2010 for some reason. Anyway, this is more nitpicking from Harriet, downplaying the effects of a food that we know causes disease. She's just saying, oh, it doesn't cause disease to the extent that they say that it does. Remember, it's only relative risk, which, as we have established earlier, means almost nothing. Yeah, right. She presents this systematic review as if it was necessarily better than the Harvard study, but she doesn't explain her rationale. A systematic review is not necessarily the best form of evidence. For instance, as Dr. Dean Ornish says, the fact that not all studies have shown this risk does not mean that it is not true. In doing large-scale studies in which people complete dietary surveys, there is often so much noise, especially in combining data in meta-analysis, that a type 2 error often occurs. That is, the noise obscures the ability to detect statistically significant differences. In the next few paragraphs, Mrs. Hall does more of the same. She finds studies that haven't found an association or ones that conclude the opposite from the ones mentioned in the documentary. She never goes into detail about the merits and shortcomings of each individual studies, though. Yawn. She thinks it's enough to say that there is contradicting data out there to discredit the studies mentioned in the documentary. It's not. It just goes to show how confusing the nutritional sciences are. Harriet claims that fruits and vegetables contain carcinogens too. She says that because the documentary film doesn't mention them, but mention the carcinogens in animal foods, they create a double standard. This is absurd, and for some reason she doesn't provide any source for her statement. Which fruits and vegetables contain naturally occurring carcinogens? Is she mistakenly confusing nitrates and nitrites? Is she referring to the various chemicals that are sprayed on the fruits and vegetables? We don't know, and most importantly, just how carcinogenic are they, if they are at all, and do they have other active compounds in the foods that are anti-carcinogens? What is the overall effect of the food? For instance, we know that if half of the US population were to increase their consumption of organically grown fruits and vegetables, an estimated 20,000 cancer cases might be avoided each year. But when it's conventionally grown, we might only prevent 19,990 cases of cancer a year instead. That still warrants an increase in fruit and vegetable consumption by a long shot, despite the carcinogens in the conventionally grown fruits and vegetables. But we have no data to suggest that increasing meat, dairy, or egg consumption could actually do this, do we? But again, Dr. Hall has her own agenda. It appears that she's not particularly interested in lifestyle medicine. She wants you to throw your hands in the air and just go, well, whatever, everything causes cancer. Might as well just eat everything in moderation. And it's like it's not worth it to carefully weigh the pros and cons so you can minimize those risks as much as possible to her. And that's fine. No one says that you have to care, but don't turn your own apathy into advice. Dr. Hall's following 5 paragraphs are pretty strange. They're just descriptive statements of what is said in the documentary. There's no critique, she's not interjecting or anything, but it's like it's implied that these things are exaggerated just for the fact that she mentions them. I don't know what to make of this. I guess she wasn't kidding when she said that she took notes. Eventually, she does offer a few exclamation points and a question mark when she's describing Dr. Michael Greger's take on endotoxins in meat causing inflammation. Apparently, impaired flow-mediated dilation and postprandial inflammation caused by endotoxins is really wild, unbelievable stuff. We have to take it on faith that it is because she doesn't review the literature that he refers to. Dr. Hall then complains that the documentary is anti-conventional medicine. She claims that conventional medicine owns prevention. So to the first point, the doctors featured in this documentary are all conventionally trained. And from what I know, they acknowledge that if you're dealing with an acute condition, conventional medicine is the way to go. What they do is not attempt to discredit conventional medicine. They're trying to make a point that chronic illnesses are largely preventable and sometimes reversible with a healthy enough lifestyle. Dr. Hall thinks that because doctors have cured things like smallpox, they own preventative medicine. The thing is, smallpox being a virus and all, it wasn't caused by lifestyle factors. Preventative medicine, as it currently exists, seeks to educate people on risk factors they actually have control over, so this is a red herring. Dr. Hall then claims that doctors are trained in nutrition and, quote, understand the principles but leave individual diet advice to the dietitians, unquote. Is this really the case? Here's what an MD who specializes in clinical nutrition has to say. Medical students are still getting less than 20 hours of nutrition education over 4 years, and even most of that has limited clinical relevance. 30 years ago, only 37% of medical schools had a single course in nutrition. According to the official list of all the requirements for those specializing in cardiology, fellows must perform at least 50 stress tests, participate in at least 100 catheterizations, and so on. But nowhere in the 34-page list of requirements is there any mention of nutrition. Maybe they'll leave that to the primary care physicians. No, in the official 35-page list of requirements for internal medicine doctors, once again, nutrition doesn't get even a single mention. There are no requirements for nutrition before medical school either. Instead, aspiring doctors need to take courses like calculus, organic chemistry, and physics. Dr. Hall proceeds to talk about Kip Anderson's phone calls to various organizations and how they seemingly have no interest in talking about preventing or reversing the illnesses that they work on. She immediately assumes that they are 100% committed to the prevention and cure, and the reason that they don't want to argue is because the evidence isn't there. You mean the evidence of all the populations that live on plant-based diets and who get a fraction of the chronic diseases that we get in the West? That's not missing. She follows up with a false analogy relating autism and vaccines and diabetes reversal and lifestyle modification, as if there was the same amount of lacking evidence for both of these. This is pretty astounding ignorance on her part. Then she states that, quote, many of the arguments for veganism are not health-related, but moral. Animals suffer, conditions are unsanitary, they produce greenhouse gases, and are bad for the environment, unquote. Yes, veganism has benefits beyond one's personal health. That's a cold, hard fact. But instead of seeing this as a fact, Dr. Hall and other veganism detractors will claim that vegans are often motivated by these agendas, in spite of whatever health problems veganism might come with. And this is simply untrue. Vegans want veganism to be sustainable long term. Duh. They would not benefit from deceiving people for altruistic reasons. If you don't feel good doing it, then the instinct of self-preservation would suggest that it's only a matter of time before you revert back to omnivory. Dr. Hall is just about to conclude her devastating piece of criticism when she mentions that all of the testimonials in the film are unbelievable, literally unbelievable. This is where I have to sympathize with her. She clearly has no one in her environment who has made that switch and who improved their health or reversed a chronic condition, and she hasn't done it herself. It stands to reason that you should be skeptical of any testimonial from people you don't know and can't verify the validity of their stories. She mentions being skeptical of athletes who say their recovery time has improved dramatically. I also think there is some wishful thinking when it comes to veganism and different athletic endeavors, and I haven't been able to find the data to support some of those claims myself. She ends up taking literally what seems like an obvious metaphor by the filmmaker and decries his rejection of the age-old tripe that is everything in moderation. Her argument is that, quote, the evidence doesn't show that everything in moderation is unhealthy, exclamation mark, unquote. Actually, just like the do parachutes prevent death type of lack of evidence, we don't really need it, common sense suffices here. One of the first things that you learn when you take a nutrition course is that we currently live in an obesogenic environment. In other words, the environment is full of traps, which, if you fall into, will increase your chance of becoming obese. Unless you are very lucky or informed and have sufficient willpower, you will be in harm's way. But willpower is understood to be a limited resource, and life can throw a curveball at you at any time, which weakens your internal resources. I mean, everyone has heard this saying and probably believed it at one point in their life. Yet, we are in the middle of the biggest chronic disease epidemic in human history. As Beth Skwaricki says, when your favorite diet advice is the same as junk food peddlers' favorite diet advice, maybe you should reconsider. She wrote a great article on this topic, and I will be linking it below. Dr. Hall's conclusion: spectacle, not science. The movie cherry picks, but she doesn't. It's alarmist, and it will probably harm you if you follow its recommendations. That's implied. If you were worried that you might have to rethink your diet, worry no more. Renowned skeptic Harriet Hall has come to the rescue to tell you that you might want to eat a tiny bit more plant foods, but you don't have to worry one bit until there is more evidence. Yeah, you shouldn't have worried about tobacco smoking in the 50s either, because, well, most doctors smoked. Also, didn't it take 7,000 studies before the Surgeon General's report on smoking came out? What, we should just wait until the 7,000th study comes out before we decide to stop smoking? No thank you. What was the American Medical Association's rallying cry back then? Quote, extensive scientific studies have proved that smoking in moderation by those for whom tobacco is not specifically contraindicated does not appreciably shorten life. Sound familiar? Everything in moderation. Dr. Hall says many of us would rather accept a small hypothetical risk, what she thinks is an hypothetical risk, than give up the foods we love. And that's the whole point. If you want to take the risk, you should be able to. But in order to do that, you have to be made aware of that risk first. Healthcare professionals who patronize people and don't even bring up lifestyle modification because they think that people are unlikely to change aren't doing that. As an authority figure, you should be nudging people into making better decisions, not telling them to make the most comfortable one. It's a comforting illusion to say, we just don't know enough. In conclusion, let me say that, although this was not my review of What the Health, I don't believe that the movie was without flaws. It's clear to me that they took some liberties to make the movie more engaging. I also found some pretty dubious pictures or memes being shared on their Facebook page too. And if I was to judge Kip Anderson superficially from a quick visit on his Facebook, the new age vibe that he gives off doesn't really inspire confidence. But the film he and others made is still vastly superior to the others that I have seen in this genre. All of the food documentaries that I've seen in the last few years typically just use sugar as a scapegoat for the obesity epidemic and the associated increase in metabolic syndrome occurrence. It's never about the meat or the cheese, it's always about the bun. Get rid of the bun, you're going to be fine. All of these documentaries are one-sided, but the difference is those other documentaries don't have a good reason for them to be one-sided. They'll blame industry influence and corruption when it suits them and ignore the influence of other big industries like big meat and egg and dairy. There are a great many reasons to adopt a vegan diet, even if it turns out that some of the science they're referred to in this documentary is iffy. What's the worst that will happen as a consequence? Will you be harmed because you've started eating more whole plant foods after seeing it? Probably not. Are you going to be eating more sugar because of it? Probably not. Can you get over the fact that they focused on something that has never been focused on in a documentary film before? This was crowdfunded and they had limited resources to make this documentary. The reason they didn't bother with sugar is not because they think sugar consumption is perfectly fine, but because it's already at the forefront of people's consciousness. Everyone and their mother knows that refined and added sugar is bad for you. They don't need to pour more money into this now. They also didn't get into paleo or so-called, quotes, ethical omnivory, which Rob Wolf decried on his blog, because they have already went into the fact that it's unsustainable in their previous film, Cowspiracy. Why bother investigating it when there's so much data on whole plant foods and only an elite few could ever partake in that kind of diet? Okay, that's all I got for now. If you stuck with me the whole way, thanks very much.